This is the story of healthcare in America. It begins with you. Are you truly satisfied with the existing healthcare system? Are all your healthcare needs being met at an affordable cost? Do you believe America has the #1 healthcare system in the world? Do you believe healthcare is a privilege for those who can afford it? Or do you believe healthcare is an essential human need and should be provided for all Americans? Do you prefer conventional medical care? Or would you like the freedom to choose complementary and alternative healthcare services? Do you really believe health is your greatest wealth? Hello and welcome to my home. My name is Kirk Mann, and I have been a practitioner of complementary and alternative medicine for over 16 years. I have learned many things about health and wellness that I would love to share with you. I would like to begin this tale with a very inspirational and amazing story. Once upon a time, there was a boy who decided he wanted to be a medical doctor. But instead of using cold, analytical processes of modern medicine, he believed in a more holistic approach. He envisioned a free hospital where doctors and holistic healthcare providers could volunteer their services. He envisioned a new model of healthcare where the patient was treated with compassion, dignity, understanding, humor, creativity, and most importantly, love. He believed that healing is not a capital venture. Healing is a sacred art. I am talking about my friend and teacher, Dr. Patch Adams. He is alive, vibrant, and healthy today at 66 years of age. You may have heard or seen the movie Patch Adams that starred Robin Williams in the late 90s. The movie resonated deeply with most Americans, revealing the old patriarchal medical system where male-dominant physicians were treated as gods or generals who waged war on disease.
I got involved in complementary medicine because I instantly saw it do things that my medicine couldn't do. And I didn't throw away my medicine, I was just thrilled to add.
Patch challenged the hard-hearted medical system with intelligence, courage, humor, and wisdom. Patch Adams is an American medical folk hero, revolutionary, and prophet. Patch Adams believes the most revolutionary act one can commit in our world is to be happy.
That I'm a multifactorial person. I rarely think in terms of single cause or single treatment. And that in the area of wellness, you want to do as many areas of wellness as you possibly can all the time.
Imagine being a revolutionary of happiness. Patch goes where fools fear to tread and uses clowning as a means to spread joy, humor, and compassion. He chooses the most impoverished and war-torn locations to bring his form of clown medicine.
I made 2 commitments to serve humanity in medicine, and I've been a free doctor in every way for 40 years.
He is one of the most courageous souls I have ever met. He is committed to passive resistance and nonviolence. As a clown, he gains entry where most would be rejected. As a practitioner of complementary and alternative medicine, I understand the profound truth of what Patch has been advocating. He also notes that we need to look at the imbalances and disease within the community or society as a whole. We have to look at the roots and causes of disease first and foremost within our society, and then the individual. Patch believes the heart of the problem begins with our political and economic systems. I say it is time for a natural healthcare revolution. Our system has failed too many Americans due to its inherent design flaws and blatant greed. We have forgotten that healing is a sacred art, and healing comes from within. Healing first comes from nature and is an inherent force within all living beings. We need to stand up and demand a more integrative and holistic approach to healthcare. I believe it is best to start with the most natural, least invasive, and least expensive forms of medicine.
It's all about the structure of the body, getting it in its proper alignment so that all the systems work as maximally as possible, as optimally as possible. And the idea is that for a lot of people who have been stuck for many, many years in positions that are not so good for their health, the bodywork can unlock that and break it open, and then I can give them a set of exercises that can reinforce that unlocking and lead to more unlocking.
Now, not later. is the time for a restoration of natural medicine. We need to restore the balance between a holistic medical model and the existing technologically dependent system. We need to reconstitute a balance of the feminine force in healing now.
I think it's important for integrative medicine to be used across any specialty, for any physician, because A, I think your patients are going to be doing these things anyways and you need to know, and they're going to be afraid to tell you what they're doing if you roll your eyes and don't like it, and B, obviously it's going to make the patient that much healthier and make their outcome that much better.
We have forgotten this essential attitude in Western culture and medicine. If we want to rise out of our despair, anxiety, depression, and disease state as a culture, we must support and utilize an integrated medical model now. As reflected in the movie Avatar, the battle between the forces of nature and exploitation are heating up. The debate about healthcare within the United States has been raging for many years. Did you know that most civilized modern nations provide different forms of universal healthcare for all their citizens? Here are some examples. Canada, the United Kingdom, Japan, China, France, Norway, Sweden, Denmark, Israel, Brazil, Germany, Costa Rica, and many more. Most civilized countries have decided that healthcare is a human right. We have accepted a profit-based corporatization of American healthcare. How is that working out for you? Did you know the cost of our healthcare per capita is about $7,300 per year for every man, woman, and child? Did you know most modernized countries who offer universal healthcare pay out about $2,500 to $3,500 per capita? We pay more than double, but are ranked 37th by the World Health Organization. We are ranked 50th for life expectancy, according to the CIA World Factbook. Something has gone terribly wrong. Did you know there are now an estimated 50 million people completely uninsured and at least 25 million people underinsured who cannot afford out-of-pocket expenses? President Obama's Affordable Health Care Act will improve these numbers and help many people, but will not change the current model of medicine. Did you know that illness and the extreme cost of health care are the #1 cause of bankruptcies within the United States? These are simple facts. Isn't the need for radical change obvious?
This idea of best medicine negates thousands of years of history of many very complex systems.
Eckhart Tolle, who wrote the popular Power of Now, teaches there are only 3 choices in life that are sane. Fully accept the situation as it is, change a situation that is not healthy, or leave the situation altogether. All else is insanity. One thing is for certain, our best defense against unsustainable healthcare costs is to prevent illness and promote our own health. When we seriously invest in our own health, we have the power to slow or eliminate the onset of disease. Health is truly our greatest wealth.
After using conventional medicine, I decided to try acupuncture, chiropractic, and massage therapy because my knee was still hurting and not bending, my migraines were still there, and my anxiety level. If it wasn't for the acupuncture, the chiropractic, and the massage therapy, I believe I would be in a wheelchair at this point because conventional medicine was just not helping.
I like natural medicine because it helps me with my nosebleeds and to make me sleep on my own.
And so for me then, what's been most effective is like an integrated, holistic approach towards my care, which involves chiropractic care in my case, acupuncture care as well, rather than the traditional prescription by, let's say, a doctor who says, take this pill and call me in 2 days and tell me how it is you're feeling. My preference is to avoid that type of treatment so I can learn to take care of myself in a more, as I said, holistic and natural kind of approach to things.
Natural, holistic, and integrative medicine has been gaining momentum in America since the early 1970s.
It's stress relieving and supports the immune system. It's great for pain relief, and so it's really good for just natural health care. So, if people get sick or injured, they can use this form of health care. It's safe, it's natural. There's rarely any side effects. Usually the side effects are more on the positive side, that people sleep better and their digestion is better, their mood is improved, they've got less stress. So it's a great way to really support the whole body and improve people's health as well as treating illness.
The American Medical Association worked hard to challenge all other forms of medicine, including chiropractic, osteopathic, homeopathic, and naturopathic systems of care. The American Medical Association won the competition, and allopathic or conventional medicine is by far the dominant form of healthcare within the United States. The tragedy is that Americans are in poor health compared to many other modern and second world countries.
Fortunately, medical schools are more and more offering courses in CAM, complementary and alternative medicine. And I want to also speak to the value of alternative practitioners in another sense, which is that they have the time and the skills available to listen to their patients, to hear what it is that their patients are saying, to get at the psychological, the social, the cultural roots of their illness.
Many Americans still lack a clear understanding about the practice and education of licensed alternative medical care. Did you know there are an estimated 16,000 licensed or nationally certified acupuncturists within the United States? To become a licensed or certified acupuncturist takes about 6 years of combined college study. All acupuncturists must be licensed by their respective state and/or certified nationally.
And I did a lot of research and I came across naturopathic medical school. And I thought it was really amazing that you could learn to be a primary care doctor, but instead of focusing on prescription drugs and surgery, you could actually use dietary changes and supplements and herbal medicines and homeopathy and bodywork techniques. And at the same time in my program in education, I got to learn about other fields of natural medicine. Like we took an introductory course in Oriental medicine and Ayurvedic medicine. So it helped me in my own life. I've seen it help many other people, especially with chronic conditions that standard allopathic medicine just cannot help. I mean, they have Band-Aids, but they don't have cures.
Did you know that there are approximately 72,000 chiropractors within the United States? To become a doctor of chiropractic takes approximately 8 years. Did you know that there are approximately 3,500 naturopathic doctors practicing within the United States? To become a doctor of naturopathic medicine takes 8 years of combined college studies. There are many other holistic practitioners within the United States utilizing nutrition, homeopathy, herbal medicine, supplementation, bodywork and massage, and psychospiritual methods. Many amazing physicians and nurses are embracing a more integrative style of medicine. It is time we demand this type of medical care and put our money where our mouths are. You too can choose a new approach. The time is now for natural medicine revolution. You want a natural revolution? I say I just want the truth. Say you just want a solution. I say show me your proof. It's been a long time, been a long time. Feel a real change coming on. It's been a long time, been a long time. See a real change coming. Feel the real change coming on. Care for others. I say I just want the truth. You say you wanna love your brother.